Well, we're excited to be here today with some great medical professionals who have come to share with us about the medical mistrust of COVID-19. I'm going to introduce them. We have the illustrious Dr. George R. Smith, Jr. This is a member of our church, and he is also a professional in education and public health. And we're grateful to have him here today, along with our member, Dr. Charles Barron, MD, who is also a member of Salem and also a wonderful respected professional in medicine, and he's a medical chief officer. Thank you guys for coming today. Thank you guys for being with us today as we discuss this important subject. So I'm going to go on and give you guys a chance to talk a little bit about this vaccine and this mistrust, the fact and fiction, and then we'll open up for questions.
Sounds great, Pastor Yvette, and I do appreciate that. What I'll do is I'm going to give a quick PowerPoint presentation so you'll be able to see my screen shortly. And so I will be sharing that. The one thing that I definitely want to do is to make sure that everyone realizes that this is a very important matter. And I'm going to go ahead and get started. And thank you again. As Pastor Yvette says, my name is Dr. George R. Smith, Jr. I'm an assistant professor in the Department of Public Health at Chicago State University, and of course, a member of the greatest church in the entire world. So thank you. So we're going to talk today about the severe acute respiratory syndrome coronavirus 2. That's what it is, everybody. This is what we're talking about. This is the disease right here. This is what it is. As I tell my students, I want you to know it, but I'm not going to test you on it. But this is what it looks like. And one thing that I definitely want to share with you, and is we want to talk about fact versus fiction, is that this virus did come from China. So this right here, as you can see, was most likely evolved from bats. And it says right here, which is a pangolin. And a pangolin is sort of like a armor anteater. We're not really going to talk today about how it got from an animal to a human. We just really want to talk about the fact today that COVID is here, and we have to know what is going on to make sure that we can protect ourselves and protect our families. So this is one brief give you an update. This is from Johns Hopkins University. This is about a minute-long video, and it's going to really show you about updates of what's happening with COVID-19 in regards to numbers as of So as you can see, it is happening. Unfortunately, it's worldwide. It's affecting us within it's a pandemic, and pandemic is just a big word to say it's all on 7 continents. And so the one thing that I really want to focus on today is that within COVID-19, it is having a negative effect on what we call ethnic minorities or underrepresented minorities in the United States, which is defined as Latinx, African American, and Native Americans or indigenous people. And so I just wanted to share this information is that people who identify as Latinx, Native American, or African American are greater at risk for acquiring the COVID virus, but also are greater at risk for deaths in regards to the coronavirus. The next slide, I really want to talk a little bit more about hospitalization. And this is some recent information I got from the Centers for Disease Control and Prevention. And this was talking about hospitalizations in between March 1st through December 5th of 2020. And as you can see, if we look at rates, and just a big word is saying how many people are affected per 100,000 population, we see that right here, Latino or Hispanic or Latinx, they had the highest rate, followed by Native Americans or Alaskan Natives, and then African Americans. Primarily, I'm going to focus majority of my information today in regards to African Americans. All Americans have been negatively impacted by COVID-19, but I really want to focus a little bit more today and deep dive into how it's affecting African Americans. And there's two words we're going to learn. It's going to be a little test, but it's coming up. It'll be in red. So, but I want to make sure that you know those two words. So the one thing I wanted to share right here, as you can see, is that the distribution of deaths in regards to COVID-19, again, have sort of proportionally affected African Americans greater than other populations. So for example, if you see this little bar right here, the red stands for is representing the number of deaths. The little blue is representing the distribution of the population. So currently, right now, African American deaths from COVID-19 is 14.5% of all of the deaths in the United States. But African Americans only constitute 12.5% of the American population. So even though we're 12.5% of the American population, we're 14.5% of all deaths. That means that unfortunately within the African American community, we're dying at rates that are higher than our counterparts. And so I want to go a little bit deeper. And so I talked about America, but I want to talk a little bit more about Chicago, because that's where we're primarily located. And as you can see, African Americans, unfortunately, we have had some higher rates of death in the city of Chicago. For example, if you look right here, and this is cumulative cases, you see that basically from March 1st of last year until yesterday, when we talk about African Americans, we had 1,947 deaths in the city of Chicago that are African American. But if you look at any of the other deaths we see, unfortunately, we as African Americans have the highest rates of death. And then if you look right here, and if I'm going a little too fast, just let me know. And if you see this little chart, you see how the purple represents African Americans. And as you can see, early last year, it was detrimental to us. For one thing, this little peak right here, which is the highest peak, that was April 28th of last year. And if we look at the rate, and it basically the city had a rate of 1.70% of deaths. The African American rate was 2.7. On that day last year, 26 African Americans died in the city of Chicago. So as you can see, our death rate among African Americans has greatly decreased, but we still are at risk from dying from the disease. It's not a joke, it's real, it's serious. The disease will kill you. And we have Dr. Barron, who's going to tell you a little bit more about some of the effects that it will have on your body, whether you get infected or whether, about the vaccine. But I just wanted to share you the information and give you the data to let you know that this is very serious. Regardless of what people may tell you, science is telling us that this is detrimental to all people, especially African Americans. So I want to go a little bit deeper. You're probably saying, well, what's going on here? I want to talk about even within the city of Chicago, where Salem's located, we're in zip code 60628. Unfortunately, even when we talk about deaths there, and you can see right here, the death rate is higher in this zip code. And one thing, if you can see right here, and this is just sort of a little bit shocking, and this little peak right here was April the 11th of last year. And and right here, the zip code is in blue represents 60628. The light blue, the navy blue, or the black, that represents the city of Chicago. On this day last year, that was April the 11th in 2020, the citywide rate was 7.1 deaths per 100,000 people. But if you go to the zip code of 60628, the death rate was 24 per 100,000 people. It was we had three times greater the death rate in the zip code of 60628 than the entire city of Chicago. So that's one thing I definitely wanted to make sure that you understand what's going on and about the seriousness of the coronavirus. And we're going to go a little bit further. And so these are the two words I said I was going to test you on: medical mistrust and vaccine hesitancy. So remember those. Those are, if you don't remember anything else, is medical mistrust and vaccine hesitancy. And so those are some things that I definitely want you to remember as we go a little bit further. So the definition of vaccine hesitancy, the definition of medical mistrust is a tendency to distrust medical systems and personnel believed to represent the dominant culture in a given society. So what that really means is, as African Americans, colonialism, white supremacy, racism, all of that has been very detrimental to us since we've been in the United States. We survived slavery, we survived Reconstruction, we survived Black codes, we survived civil rights. We've been through it all. But unfortunately, because of those negative aspects to us and our interfacing with healthcare, we developed medical mistrust. And some people are thinking, oh my God, why is that? We all know of someone, unfortunately, who has had a negative experience with the healthcare field. And then they tell us, they tell someone else, they tell someone else, and then, i.e., we have medical mistrust. And so how did we get here? So we first started with really medical experimentation. And so this picture right here is, this gentleman right here is known as Dr. James Marion Sims. He's considered the father of modern gynecology. So he was a physician who lived in Montgomery, Alabama, who was a slave owner, but believe it or not, is considered the father of modern gynecology. So he had slaves, and he also had slaves from neighboring plantations, and he would do medical experimentations on them. So for example, this picture right here shows the name of 3 of them. And these are 3 slaves who, their names are escaping me right now, but he performed medical experimentation on them as well as numerous others. Because he was able to develop certain techniques that are used today in modern medicine, he's considered this, but please note that many of the great gains that we've made in gynecology and obstetrics were done based upon the back end as well as the reproductive areas of African-American women who were enslaved. So you're saying, well, okay, medical experimentation, that really can give you distrust. It can, it really does. So the next thing I want to talk about is Henrietta Lacks. Here we go again. So Henrietta Lacks was an African-American woman who was from Virginia and was diagnosed with cervical cancer in 1951 after going to a visit to Johns Hopkins University. And this is a picture of her right here. Of course, they did something called a biopsy, which is just basically a minor operation going in and getting some cells. Well, the one thing that the researchers there and the medical staff noticed that when they got her cells didn't die. As a matter of fact, her cells kept doubling every 20 to 24 hours. And so it kept going, Shortly after that, in 1951, Miss Lacks did die, but we were able to get something called HeLa cells. And this is a picture of it right here, the one at the bottom. And those came from the first letters of her first and last name. And then those cells are continually used now today to look to study at the effects of toxins, to look at effects of drugs, hormones, and viruses on the growth of human cells without human experimentation or involving humans. So again, we had Henrietta Lacks. You're probably saying, okay, what else could happen? Then we had the Tuskegee syphilis study in 1932 to 1972, which was officially entitled The Study of Untreated Syphilis in the study of the untreated syphilis and the American Negro. So this was conducted in Tuskegee, Alabama. It was done by the United States Public Health Service, meaning it was funded by the United States government, in which 600 African-American males, 4 of them who had syphilis, were monitored for 40 years. The one thing that I really want to say and really emphasize, because we're talking about fact today, none of the men were infected with syphilis. So I want everyone to understand they were not infected with syphilis. These are some pictures of the men who were the participants. They had syphilis, but were never told that they had syphilis. So how they were recruited was that they were told, and of course this happened in the 1930s with the Great Depression, they were told that if they participated in this study and they had something called quote, quote, bad blood, they would be able to get medical care. And if you think about it, in 1932, we were at the height of the Depression. The vast majority of those individuals were sharecroppers. they were just trying to keep their family fed. So if someone came up to you and said, hey, if you participate in this study, and also one thing they're using, a big word, malfeasance, mean being mean and try to manipulate you and say, hey, I'll give you free medical care, you would participate too. So the one thing that I'd like to share further about this was that even though penicillin came into effect in the late 40s, early 1950s, to let you know that it could treat and cure syphilis, these men were excluded from that. They were never given penicillin, never. And one thing that is also very sad is that many of the participants did die from syphilis, and they really didn't know that they had syphilis until 1972, when the research came to light and came into the American public. So let's talk a little bit more. You're saying, well, why are we hesitant? So now let's talk about vaccine hesitancy. I won't read it verbatim, but basically it's just saying that it's when you delay getting vaccines. And we are concerned. Why are we concerned? Because history is not on the side in the United States of African Americans as we interface with the healthcare system. I'm not saying that the healthcare system is racist, but there are racist people within the United States healthcare system. And we must be very mindful of that. And we must make sure that we do what we can to educate everyone about that. Next, we're going to talk, there are 3 vaccines that are available right now in the United States. It's Pfizer, BioNTech, Moderna, and the Johnson & Johnson. And then we'll talk a little bit more. I'm going to defer to Dr. Barron so he can give you more information about that. But I want to bring that to your attention. And then I just want to give you the science. This is the truth. Now, this is the truth. These are the facts. These are common side effects that you will get from getting the COVID-19 vaccine. So once you get the shot in the arm, you may have some pain, you may have some redness, or you may have some swelling. Throughout your body, you may have some tiredness, you may have headache, you may have muscle pain, you may have some chills, you may have fever, you may have nausea. Dr. Barron's going to tell you a little bit more. I will go ahead and tell you that I got my first shot. I had Pfizer on January 6th, and then I got my second shot on January 27th. January 6th, I had some soreness in my arm when I got my first shot. The second time I got the shot, I had no issues. Again, we're all different, but I want to let you know I am still functional. I am still teaching. I can talk right now. I didn't grow any extra limbs. My eyes didn't turn green or anything, but I'm just letting you know that you can get the shot. I know everybody's different, but I'm still here. So, and Dr. Barron's going to tell you a little bit more, but I'm kind of advocating that you get the shot. I'm just going to be honest. I know, talk to your provider, but get the shot. And then last and definitely not least, I want to talk about the Black immunity myth. So this was early last year around March, and it was going out, oh, Black people are not going to get COVID-19. We got melanin in our skin, and that's the super thing. It's going to protect us. A month later, we were dying at astronomical rates. So I just wanted to give you this background information about what is going on about COVID-19. And now I'm going to defer to Dr. Barron. I just wanted to give you some background information so you can have facts, because we tend to make better decisions when we have the facts versus emotion.
All right. I don't know if there's some questions. I don't even know if I can follow you, George.
Yes, you can. Because I'm not a clinician. I can't diagnose. I can't do any of those things. So you all might want to ask Dr. Barron some questions.
No, but no, that was excellent to give us a kind of a foundation of what our history is and why we are hesitant about taking vaccines, taking medications, going to the doctor, the whole 9 yards. So, and that was very good information. So I don't know if you have some questions you want to ask George to start off with, or Dr. Smith to start off with, or I can just kind of go into some general things. I don't have a PowerPoint presentation. I just like to talk. I like to answer your questions, because I think it's better served now that you kind of have the foundational information. And I'll give you a little bit more details about the vaccines, but we want to answer your questions, because I want to know, why are you hesitating, and try to support you in that and give you information, or dispel some of the myths and those type of things. So we'll start with just briefly the 3 types of vaccinations. We have the Pfizer, the Moderna, and the J&J. Johnson & Johnson. So the big thing is that, yes, we're all promoting the vaccination. You need to get the vaccination. But then there's a question, okay, which vaccination should I get? Then there's questions, it happens so fast. Is it really efficacious? Does it really work? You know, and all of these different questions that people have, and people ask me every day. So first thing I'm going to start with the development of the vaccines. So the Pfizer and Moderna uses a messenger RNA or a protein that is specific for the spike that's on the coronavirus. And if you can go back to, remember the picture that Dr. Smith showed, the virus had all these little spikes, these little things sticking out the side of it. So those that's the major component of the virus that causes infection. These spikes go into your cells and they stick into your cells and they replicate and divide, and ultimately you get sick. I don't want to get too detailed or and talk too over people's head and lose you all, and we gain nothing from the conversation. So, but the spike is the key component of the virus. So what the scientists did was they got it's a messenger RNA or a protein that represents that spike, and they put it into the vaccine. All right, so that's kind of the real a high level of what the vaccines are. So that's the Moderna and the Pfizer. Now, the Johnson & Johnson is a little bit different in that it is it's the same similar protein, but they put it on top of a cold virus. So the adenovirus is a virus that causes the common cold. So they kind of, for lack of a better term, injected the common cold with the same type of protein, the spike that causes the spike. And so when the Johnson & Johnson is injected into you, they're injecting the common cold virus or the inactivated virus. So it shouldn't cause you to have a common cold, but it's just kind of what we call a vector, meaning that this is how it's transmitted to humans, okay? So we have the Johnson & Johnson, which is a virus with the protein for the spike attached to it, and they inject it into you. The Moderna and the Pfizer are somewhat similar in that they're just giving you that protein that causes the spike, and they inject that into you, okay? Now, the thing that we don't hear a lot about is efficacy. You hear a lot about, well, it's 100% to keep you from dying. It's 95 to 100% keeping you from getting really sick. But what we're not hearing a lot about is the efficacy. Efficacy means, whether or not this vaccine will prevent you from having symptomatic disease. All right, whether it's mild or severe. So I'll stop right there and say we've heard people that are asymptomatic carriers, meaning they have the virus and they have no symptoms at all. Then you have the extreme side of it, the other end of it, where people are dying. They can't breathe. They're on intubated or on ventilators at the hospitals, and it's a very poor outcome once you get to that point. All right, so when we talk about efficacy, we're talking about the front end of it, whether or not you have a symptomatic disease or not. Pfizer and Moderna, 95% efficacy, meaning that you have a 5% chance of really getting sick or having symptoms if you come in contact with the virus. Johnson & Johnson is about 70%. So you have a 30% chance of getting symptomatic disease from if you come in contact with the virus. All right. Now that's not to say don't get Johnson & Johnson or don't get the other. I'm not getting paid to promote any. I should have said a disclaimer earlier. I'm not getting but I just want you to have the real information and understand it. Okay. So I hope I haven't talked over your head, but just understand that the Johnson & Johnson, it's effective. And if you can't get Moderna or Pfizer, get Johnson & Johnson. But just know there's a little bit of difference, okay? Some of the technical stuff about transporting it and being in the freezer and all that, I don't think that that's really relevant for us right now in the conversation. That's more on the medical side of how we have to take care of the vaccine once we get it, and keeping it cold and those type of things. What I can say is for all three of the viruses, once we open that vial, we have about anywhere from 6 to 8 hours to use the medication. So that's why you hear people saying that, you know what, I just got called, or I was standing in Walgreens and they asked me if I wanted it and they gave me the vaccine. That's because we cannot waste any. And if someone didn't show up, then we got to get rid of it. So it's like, hey, you want the vaccine? Come on, get it. So, you know, I've heard people say, well, I'm just going to go stand in Walgreens and wait. You know, you might, you know, you might win the lottery, you might not. But so that's why you hear it saying, well, you know, you have 6 to 8 hours to use it once that vial is open. So we have to get it. And that's why, too, we have this kind of barrier, is that you have to have an appointment because people are really concerned about wasting it. So we know if we give you an appointment and we know how many shots come in each vial, which is about 10 to 11 per vial, then we know how many shots we can give that day. All right. And then if somebody doesn't show up, then we need to call or go out in the streets and grab somebody and say, hey, come get this vaccine because we don't want to waste it. All right. So so that's kind of where we are in terms of getting the vaccination, where different types of the vaccination. As George mentioned on his presentation, after the first shot, I've seen various responses. Some people have no response at all. They are doing well. They may have a little soreness in the arm and that's it. And then some may have anywhere from a little fever, chills, extreme fatigue. So it's just different. Some redness or more redness than expected in the injection site. So you may see that. So it just varies from person to person. And after this, usually after the second shot, you may have a little more symptoms. And that's where you see more people having more symptoms after the second shot. And those are the same symptoms of fatigue, fever, a little bit of chill. It may last 3 or 4 hours, but usually 24 hours is what I've heard has been kind of the max of most cases, is about 24 hours, not feeling yourself, but after that, you're feeling fine, okay? Now, just note though, those symptoms that you're having means that your immune system is working, because that's what we want. So with Moderna and Pfizer, they're giving you 2 doses. You get the first injection, and that kind of revs up your immune system. Say, hey, this doesn't belong here. So call your cousins. Let's go see if we can do to get, you know, to get rid of this virus. And so your immune system gangs up and goes and attacks that virus. But now the second time, we calling everybody in the family. So everybody coming, they clearing the porch, your cousins, your neighbors, everybody in the neighborhood is coming to attack that virus. And that's why you may have a little bit more symptoms after the second dose. So it's hyping up. First dose is kind of revving up your immune system. And the second dose is to make sure that your immune system is on point and working, and it's gathering all the defense mechanisms in your body to get rid of that virus. And I hope that makes sense to you guys. So, you know, in Mississippi, it's like, you know, when you pass by the Johnson's house, the Johnson's gonna clear the porch if y'all mess with them. So that's what happened with your immune system. They clearing the porch. They're calling everybody to attack that virus. All right.
That's good. Dr. Barron, we've got quite a few questions for you.
Okay, all right. You know, I can talk now. I'm a talker.
No, and we love it. We love it. But I wanted to make sure we got to these questions. So one from the Zoom, it says here, why is there a one type of vaccine for all medical conditions instead of a one for each type of medical condition? I'm not sure if I completely understand it, but hopefully you do.
Okay, so are you saying in one type of the vaccine for the coronavirus?
Yeah.
Even regardless of what medical conditions you have? Okay, yeah, because the issue is that there's a common component in all coronaviruses, and that's that spike. Now, there may be, over time, there may be some mutations where the spike is a little bit stronger, or the spike does a little different than the person before. It's just like, you know, people in your family, we're all Barrons, but we have some differences. We all have, the same genetic type, but we might be a little different, My wife has more hair than me or something, but so there's a little bit different, but we're all Barrons, and there's a core part about of that. And so that's what the scientists have developed the vaccine to do, is to attack the core component of that virus. Now, why does the virus have different responses for different people? One is because of your genetic makeup. Two is because you may have some comorbidities or other disease processes like diabetes, hypertension, heart disease. So your body is not as strong as it should be to be able to fight it off. And so we have seen that people with other diseases have not done as well. And again, that is also consistent. I wanted to say this earlier as well. Everything that we've seen with coronavirus is consistent with the health inequities that already existed. It's not anything new in terms of us not having health equity in the African American and the people of color communities. So it's expected, because they haven't taken care of us the way that we should have been taken care of prior to Corona. So now this is where we are.
I have a question from Facebook that says, do we have to wait to receive an email invitation or a phone call from our PCP to register to get the vaccine for group 1C?
1C.
Mhm.
Yeah, so once 1C is open, I think, it just kind of depends on your healthcare provider and how organized they are. They should be reaching out to you if you fit into the group 1C. So there should be a process, but I guess with the mass vaccination sites, you'll be eligible to put your name or reach out for appointments. But hopefully, your healthcare provider has the data that they can pull to see, okay, this patient fits into this category, and they'll reach out to you so that you can be on the list to get the vaccine.
Another question, how long does immunity last after having been vaccinated?
Okay, so those studies are still out, but right now we're saying 1 year. And so there's a great chance that next year we'll be getting a booster shot. But again, right now we're still looking at the data. This is still brand new. We haven't had a year of data for the vaccine, in real time or real life, should I say, to really say how long this will be. But right now, from all the things that I've read, it's going to be, right now we're saying 1 year.
It says, question from Facebook, it says, in addition to having any other underlying health conditions, does having reoccurring sinus infections pose a greater risk for experiencing residual effects of receiving COVID-19 vaccine?
So side effects from the COVID vaccine, it has not been connected to any type of disease processes or anything that I know of yet. Again, a lot of the data is still coming out, and we're really assessing that. But in terms of the vaccine, they have not connected it to the side effects of the vaccine to any disease processes.
One question that we have here from Zoom, and I think you already talked about the differences in terms of efficacy, but the question was, other than how the drug is stored, is there any other major differences between the Pfizer and Moderna vaccine?
Pfizer and Moderna? No, I think they're pretty close in terms of efficacy. They're right around 90, 94. I think Moderna may be 94.1 or something. Pfizer's 95%. The side effects are pretty much similar. Now the dose is different. So Pfizer is injecting a lower dose than Moderna. So I think you get about 3 times more of the dose with Moderna, and they're finding that again that there's no difference in the dose. But I think Moderna might have been just a little more aggressive in preparing their vaccine. So But that's pretty much it as far as I know. Dr. Smith, you may have something to add, but I think that that's pretty much it, is that the doses is a little bit different and efficacies are almost neck and neck.
And I agree with you, Dr. Barron. The one thing that we definitely want to say is don't pick a site to go get the vaccine. Don't pick a vaccine because it's urgent. And so when we talk about the efficacy, as Dr. Barron said, the goal is to make sure you get the vaccine if that's what you and your provider decide. But let's not get caught up because, you know, everybody has a theory. And one thing I definitely want to say is that be careful where you're getting your information from, because I've seen a lot of videos. I saw one video, no offense, the gentleman was in his kitchen. I'm just saying, you know, we have people who are properly trained and look like us, who have advanced degrees, and they can give you the truth. Let's not listen to people who have not been trained formally. For example, we are all practicing Christians and members, and many of us may be members of the Salem Baptist Church of Chicago. It is our expectation that if someone comes before us to present God's word, has had some form of theological training. So I would ask that you apply that same expectation and measure when people are giving you information. To please double check, because there's a lot of false information that's out there.
That's good. We have a question from Facebook. It says, my sister has had two stem cell transplants. Should she get the vaccine if it's only going to be 30% effective for her?
And that's the Johnson & Johnson, but is that's effective? Is that what she's saying? It's the Johnson & Johnson? Well,
No, she's saying that the vaccine, she says, if it's only going to be 30% effective for her because she's had the two stem cells.
Okay, I understand what you're saying.
Mm-hmm.
Yeah, so I would just say she should have a discussion with her provider, and he or she will give the recommendation in terms of getting the vaccine. So, but I have people, patients and colleagues who have autoimmune diseases and are immunocompromised, and their providers have recommended to go ahead and get the vaccine. But always defer to your provider when you have concerns. Definitely as serious as though as this case, just defer to your provider.
There's a question here on Zoom. Please talk about, after being vaccinated, the chance of infertility. She said that she's read that drugs doesn't cause the infertility, but she's confused about how this is a fact and when vaccine hasn't been administered for 9 months, which is the amount of time to carry a baby. Can you talk about the infertility issue?
Unfounded. There's been no real data to show this. This is something that I think somebody decided, as George said, somebody standing in their kitchen said, hey, I'm gonna say this. There has been no data to support infertility from this vaccine. So definitely any men or women who are of reproductive age should still get the vaccination. Now, I want to jump, if you don't mind, into one thing about pregnancy.
Please do.
So now with pregnancy, the CDC and ACOG, which is the American College of Obstetrics and Gynecology, recommends that you get all the information that you can about the vaccine. So the providers are held to making sure that you inform the patient as much as possible, all the information that you can give them. And at the end of the day, it's going to be the patient's decision whether or not to get the vaccine. So, so you should have, if you're pregnant, have a real sit-down conversation with your obstetrician to make sure that you're getting all the information that you need, and you can make the decision with the provider if you would like. But at the end of the day, it's going to be your decision. There hasn't been any ill effects to the babies at this time. But again, this is very new, and this is one of those things that we don't want to harm an unborn child. And if you are pregnant and you have gestational diabetes, or you may have heart disease or other comorbidities going into your pregnancy, what I've seen is a lot of providers have recommended getting the vaccine because you're at even a higher risk. So, but again, it's your decision, but make sure you get all the information you can from your obstetrician for pregnancy.
Another question from Facebook. The question is the waiting period between, what is the waiting period between getting, if you have the 2 shots, what should be the length of time for the waiting period between the 2 shots?
So for Pfizer, it's 21 days, a minimum of 21 days. And for Moderna, it's a minimum of 28 days.
Okay. Here from Zoom, they're asking, when can you expect vaccine if you don't have insurance or no known underlying conditions?
Now, so those 2 different questions.
Right.
Not insured should not stop you from getting the vaccine. I'm the chief medical officer for a federally qualified health center, Aunt Martha's, throw my little shameless plug in there, Aunt Martha's Health and Wellness. We have 25 sites throughout the state of Illinois, and we do not turn people away because of insurance. Now, whether you fit in 1A, 1B, and 1C, that's a different story. So you have to get to get an appointment. You need to be one of those 1A, 1B, or soon to be 1C. But again, being at the right place at the right time or being on the waiting list, you may be able to get it sooner. So we're just waiting on, in terms of for it to be able to vaccinate everybody, we're just kind of waiting on the government or those that make those decisions to open it up. But yeah.
And Dr. Barron, I'm glad you mentioned, Dr. Barron, I'm glad you mentioned the government. One thing I wanted to share, one of the challenges that we have here in the United States is that we don't have a national health service. So all of our healthcare is delivered by private parties. So there are some governmental agencies like the VA, but generally speaking, our healthcare is dependent upon private entities. And because it's dependent upon private entities, we're having some challenges with the delivery. For example, we have to follow what the United States government says. In Illinois, we have to go by what the Illinois Department of Public Health says. And those of us residing in Cook County, we have to go by what the Cook County Department of Public Health says. And those of us who may live permanently in Chicago have to go with the Chicago Department of Public Health says. Not majority of the time, they are all on the same level. Sometimes they're not. So the one thing I want to share with the listening audience is that the United States isn't perfect, but having a public health, having a universal health care, some people may debate me on that. That's not the purpose of it. But because we don't have a national health care service, we have these bumps in the road because we don't have a nationally mandated mechanism to distribute vaccines or any other type of health care.
Thank you. There's another question here in the Zoom. They're asking the question, it says that after receiving the 2nd shot of the vaccine, can you be around groups of people? Do you still need to use your mask? And I think I started with you in the beginning asking a similar question to that. Are we free to roam around the world again? I mean, can we have 300 or 400 people together and gather? Can we, have a party with all these groups of people? What's the deal?
So I'll start, and I know George, you over there biting at the bits to jump in on this. So, once 2 weeks after your 2nd vaccination, or if the Johnson & Johnson, I think it may be a little sooner, but I'll just say generally for 2 weeks after your you completed your vaccination series, be it 1 shot or 2 shots, you're considered protected. However, what the CDC is recommending is if you're having small gatherings of people who have been vaccinated, you can hang out and you don't have to wear a mask. If you've been completed and vaccinated and it's a small group, I would say less than 10. Now, if you're in a large group, even if you've been vaccinated, you should still wear your mask. You should still do your social distancing. You should still wash your hands. You should still, make sure that you're protecting yourself and protecting others. being vaccinated does not mean that you can't come in contact with it. You do not have a force field around you that's going to block the virus from getting on you. That's not what it means. So there is still, we're still researching and evaluating, once you're completely vaccinated, if you come in contact with the virus, it can still, penetrate your body, go into your nose or what have you. But can we spread it to someone who's not vaccinated? So we're still looking at that data to really be firm about that. So going into large gatherings, you should still wear your mask and you should still do your social distancing and so forth. George.
I concur. Wear those masks.
Yeah.
There's another question after, it looks like, what are your thoughts on herd immunity?
That's what we're trying to get to.
Right.
I feel that, that's been proven. We look at measles, mumps, rubella, we look at chickenpox, we look at all the different vaccinations that we get now and our children get. And that's what we've created is herd immunity and to get rid of a lot of diseases that have plagued us in the past. So I believe that it's real. I believe that we have evidence that, it's effective. And so that's what we're trying to get to. And so that's why we're trying to encourage all of you on this, if you haven't been vaccinated, to get vaccinated.
And I concur because I think sometimes we have to look at history. I wasn't here yet, but I remember in studying, particularly looking at public health history, polio. Polio was a very infectious disease. And if you have some time, you can see, from my understanding, it was like we are now. People would literally panic, like, oh my God, somebody has polio. But guess what? We started giving the vaccines. Majority of us have had not majority, all of us have had the polio vaccine. We're here talking. So, and even the science wasn't as advanced as it is now in regards to the polio vaccine. So the one thing, are there some vaccines that may have some side effects? Have some people died from the coronavirus vaccine? Unfortunately, there has been some. And Dr. Barron, I'm not sure of that number, but it wasn't 1,000. It wasn't 200. But someone says, well, I don't want to be that one person. Well, I always tell people when they're a little hesitant, I say, you drive down the street going west on 95th Street, and you have no problem going west on 95th Street. But why are you so hesitant? Because that person heading east could easily veer into your lane and hit you head on, but you keep driving west on 95th Street. So have a little faith, Christians. We got it.
Another question that was asked, is it true that those who receive the vaccine are automatically emailed in a clinical trial?
No, to my knowledge, in order for you have to sign up for trials in this day and age. You have to give consent. Right. So there are opportunities to get in trials, but to my knowledge, you're not automatically put into any type of trial.
No. And Dr. Barron, you're 100% correct. We have several laws because of the Tuskegee syphilis study, which evolved in something called the Belmont Report. Because of that, now you have to have something called informed consent. So even though when you're getting those the vaccine and make you sign all those papers, it is saying that they're not going to share your information. So that is a clear violation of federal law for you even to get that. I'm not sure, but no, as Dr. Barron said, clinical trials are something that's totally different. And in to participate in any clinical trial, usually it's through, you may see advertisement or it may be through your provider, but they have to go through a process to make sure that you completely understand what is going on. So I'm just very leery of anyone sending you an email about a clinical trial. That's just I would be very cautious.
Right.
There's another question. They're asking, I get it. They're saying if we're looking to get herd immunity, why don't we have 24 or at least 18 hours a day that's available for the vaccinations?
So that kind of goes back to our delivery of the health. We do not have a national health care service. We do not have that in the United States. So we're depending upon private medical centers, community hospitals, academic centers, community-based organizations, faith-based organizations, colleges, pharmacies. We're everybody. And because we don't have that in place, we have to be at the dependence of those organizations. And unfortunately, that's just a problem that we have in the United States. It would be great if we could have a 24-hour center, but who's going to pay for it? Where those supplies are going to come from? Who's going to staff it? And who's going to do the protocols?
Yeah, that's it. 100%. We are trying. We try to make the vaccine as accessible as possible, even in my organization. But again, as George said, there's other factors that play into that, and then we have to, there's labor laws.
Right.
Have my medical assistants and nurses there for 24 hours straight. So we're trying to figure it out and increase the access. But yeah, it is.
Yeah, it's tough, isn't it? One of the questions that came from Facebook, she says that I have a 14-year-old granddaughter who has not been, has not been or will not be vaccinated soon. Can I hug her since I've had both of the Pfizer shots?
Yes, if you're 14 days out, even if you are, even after you've had the vaccination and you're 14 days out, and if you even come into contact with the virus, the CDC says that you do not have to be isolated or quarantined. So you are safe to hug your 14-year-old. But I mean, again, it would kind of be a good hug and get back your way. Just be careful. Just be careful. But yeah, love your child. Love your child.
Right. And Dr. Barron, since we were talking about hugging, hugging happens between adults too. But let's just be mindful, because I think that's a question some people may not be comfortable asking, but we know married people hug. We're gonna say that. And so if you're married and both you and your spouse have the vaccine, it's okay to hug each other. Now, if one of you is not vaccinated, you may really want to think that through, because it is an infectious disease and you may not be able to hug. And then
George is saying that's not me. George, I see Lisa Howard on here.
I'm just giving you the science.
I was getting ready to get married. Lisa, George is saying that not me.
I said hug. Hug. That's what I said. That's what I said. And I'll stick by it. I said hug.
Okay. No, I understand. I'm just happy.
But just be mindful of adults hugging each other. You just have to be very mindful, because you just have to be mindful.
Absolutely. One other question I have here in the Zoom right now, it says, what are your thoughts on the government heavily pushing vaccines toward Black and Brown communities as a form of social justice?
Now you didn't got me started. So that's my platform. So I might get in trouble for this, but I'm going to go ahead and say that's the least the government could do. I will share this with you. We're hesitant about getting the vaccine, but there are non-African Americans that are coming into our neighborhoods getting the vaccine. I'm going to be honest. And so therefore, let's just be very mindful. It's not like it's owed to us. You're not doing us a favor. We pay taxes, our parents pay taxes, our grandparent pays taxes, and then we're not going to talk about the almost however many years, depending upon when you go from 1619 to 1865, when we did a lot of work for free. So and the government is supposed to take care of its people. Any government that doesn't take care of all of its people should be ashamed of itself. That's what the government should do. And we know that there are disparities. There are disparities among African Americans and Latinx, because the vast majority of African Americans and Latinx, we are what we call essential workers. We can't remotely work. If you are a certified registered nurse, if you're a CNA, you cannot do your job remotely. If you're working at some of the major retailers, you cannot sell the product from your living room. You have to go to work. And so that's one thing that we have to keep in mind in regards to people of color, particularly African Americans, Latinx, and Native Americans. We have to leave, the majority of us have what we call essential jobs, and we have to go out and leave the house to do that work. That's not a fault of ours. That's just the reality of the situation in which we live. And we have to be very mindful of making them the victim or saying it's their fault because they have to go to work. No, we all have to go to work. That's just the reality of the situation.
There was a comment that was put here that she had heard that Israel was #1 in the world when it came to vaccinating their citizens.
There is some truth to that. I think there's another country that's done a better job. One of the reasons why Israel did a great job because they have a national health service. So they have that. Number two, they have a smaller population. And they also don't necessarily have a history of disparities as that though we have in the United States. Roughly, Israel, 70 plus years old, does have some challenges in regards to Palestinians, but does not necessarily have the history that we have. But because of it's a smaller nation and because of its infrastructure, they have a strong biotech community. And so therefore, because it's a smaller nation with a national health care service, and they had the infrastructure to get the vaccines out quickly.
Those are all the questions that I have. So you all can, continue the conversation or we can kind of wrap it up. I think one of the questions that I did get a call from, because they weren't sure if they were going to be able to be on or not, is that the fact that, our churches are considering returning to gathering, churches all over Chicago, all over the nation, all over the world. And with now the opening up of Mississippi, the opening up of Texas, and then also the resurgence of another strand of COVID-19 coming through. Is it safe to return to our churches and to our worship without masks?
No, I mean, I would think, anything can be done safely, and I would just say that this just keeps safety in the forefront of our minds. But on the other side, I would say my thought is we need to slow down because we're anticipating a second spike. We don't know what these new variants are doing. We don't really know because we're not really testing for them specifically. So we don't know what the impact of those new variants are going to be as the nation, as a city, as a state, or what have you. So my thought is, with opening up, let's kind of slow down and be mindful, but let's also continue to practice our safety, and I wouldn't say let's cram 20,000 people in the church. I mean, honestly, I wouldn't say that. So we would have to be methodical about how we're doing that. We would still need to keep our social distancing. We still need to keep our masks. We still need to do all of those things, regardless of how many you allow into the churches or other large venues.
Well, I don't know if we have any more questions. I haven't seen any more in the chat. I did see a thank you for you guys. And I want to thank you guys for taking out of your time of your day to, inform us and to help us to deal with this mistrust of this vaccine and also the myths and also the facts of that. So thank you so much. Any last words from any of you?
I have one shameless plug, but this is on behalf of Chicago State University, located 9501 South King Drive. We're down the street. The semester will start soon for the summer. You want to come to my class? Come on to Chicago State. Let me indoctrinate you into public health. So we've been here since 1867. We'll probably be here again to 2067. So Chicago State, we're right down the street. Come on down.
That's my brother's alma mater. Yeah.
There you go.
No, so I
shameless plug.
I want to just say thank you guys for giving us the opportunity to talk to you. We hope that this has been beneficial for you. You know, and we're more than welcome to do it again. If, you know, something comes up and we need to talk again, or you have more questions. And if you have questions, even after this, send them to Yvette. You can send them to us and we'll answer them and try to get it dispersed out to you guys. You know, if you don't do it for yourself, at least do it for your loved ones, you know. You know, sometimes it's not all about you. It's about the people that love you. So let's be safe. Let's get this vaccine. Let's do our thing.
Okay, you guys can open up your mics and give them a hand. Tell them thank you so much.
Thank you. Thank you so much. Wonderful information. Thank you.
You're welcome. You're welcome.
Thank you to the
We're
both
gonna
of you
sign
all.
off of
Thank you.
Facebook now.